So when people are looking to have a facelift, it comes to questions like, what is that? What really are we going to perform? And the facelift is different depending upon who you talk to. And it will be different between patients for me. Some patients, which we might talk about a facelift, we're really talking about just the upper portion of their face, the cheek area. So we get very specific with that and call that a cheek lift, whereas other people might call it a facelift. Some people, when they're talking about a facelift, they really think it includes eyes and something with the brow. Well, we call that a facial rejuvenation. So terminology is very important when you are trying to figure out what you want done or what you're going to have performed. So you have to be very specific when you talk to your surgeon about the problems. And it's probably better to come in and say what bothers you and then figure out what the procedures are to accomplish that. People always have the question of what is it going to cost? And there are a number of different factors that go into that. One is, what is the actual procedure that we're going to do? And then you look at the time it's going to take or multiple procedures that are going to be done at the same time. I think people fear that if they come in and say this is how much money they have to spend, that we're just looking to charge them that for the procedure. Well, that's not true. We have set costs. A face neck lift is $8,000, whereas a cheek lift, a smaller portion of that procedure, is just over $6,000. And so that's one factor. We know what these procedures cost. And then the time. So in someone, that procedure might be one that we can do in an hour and a half, just because they're thin, they don't need as much done. Well, that's going to decrease the cost because they don't need as much time for operating room and anesthesia. Or someone might have a heavier face or a fuller face, or maybe they've had a procedure someplace else, which is going to make it more difficult. And that's going to take a little bit more time for us to be doing a little bit of corrective work. Factors that can increase the cost or decrease the cost would be length of time. So if the procedure is going to be longer, it's going to cost more just because of operating room and anesthesia cost. Factors that might complicate the technical aspects of the procedure. Someone's had perhaps a facelift in the past and the results were less than ideal. And we're having to come back and do some corrective work. Well, we know that it's going to be more difficult and that we are going to be more likely to need to come back and do some little tweaking of the results. By our nature, we really don't like to have to charge when patients come back for little tweaks on their result. So the charge for that might be a little bit higher up front if you think it's going to be an extremely difficult case. One area that I'd like to expand on pricing, and I gave an example at one point in the past of a facelift being $8,000, which I know is a lot of money, but that's the base of what we're starting with. When we do something like eyelid surgery at the same time, we actually have an economy of scale, and that allows us to make the price for the eyes less. So whereas I might look at my sheet and see that if someone were just coming in for their eyelids, their upper eyelids would be $3,000. But if they're doing it at the same time that they're doing something else on their face, well, that's only $1,500. So it is additive, but it doesn't add up as quickly when we start doing multiple procedures. So we do like to look at, how much can we do in a certain amount of time, and how many different procedures really work economically as well as physically. So there are some great options that way. So patients will come to us and they will have been to see another physician and they will have a price for the procedure. And they'll say, well, you're not exactly the same. Why is that? It might be that we are more, it might be that we are less, and they're looking for what are the differences. And unfortunately, it's not like buying a car where you know that if you're going to go buy a Toyota Camry, that if you go to one Toyota dealer and you go to another Toyota dealer, you're going to get the exact same thing, as long as your sheets line up. Well, it's unfortunately not like that with plastic surgery. The expertise of the person performing the procedure, the facility in which it's performed, their history, all those things are factors that people should consider, and they should look not solely at price, but at value. And then make sure what's going into that. I said that we might be cheaper at times than other people. We don't look to be the most expensive. We look to provide an excellent value and excellent service for our patients. And they're saying, well, why can this doctor charge more? Well, he chooses to. He might choose to charge more because it makes him look better, or it might be that his facility or his area of the country just require that that's what it needs to be paid. So when a patient will come to us and they have a bargain price, they're shopping, they've gone to 2 or 3 people, and they've really got a lowball offer, it seems. We have to try and educate them to make sure that they understand what they're getting. It may be the same name on the procedure. They might be calling it a facelift, when indeed it's just a very miniature type of procedure, nothing to the extent that what we feel they need or that they would get at our facility. And then also, who is the person performing it? Have they done hundreds or thousands like all the doctors here have, or is this their second or third one? Did they learn it at a weekend course and they're doing it just under local anesthesia in their office procedure room, whereas we have full anesthesia services to be able to provide? So there's a lot of little things, or maybe not so little things, to look into when you have that so-called bargain. Go ahead and hit the like button if you enjoyed this video, and subscribe to the Austin Weston YouTube channel to stay up to date with the latest in cosmetic surgery. For more information on the Austin Weston Center, visit our website at austin-weston.com or click the link in the description below.